So what is PrEP for HIV prevention? PrEP stands for pre-exposure prophylaxis. Pre-exposure prophylaxis actually means when you are taking a medication to prevent a disease. So you're trying to prevent HIV from being transmitted for patients who are at high risk. So you're taking a medication so that you don't get HIV. PrEP prevents HIV. The medication that we use actually is part of the medication that we use for HIV treatment, but the medication for this PrEP, it does prevent HIV. PrEP should be taken by patients who have high risk to get HIV. So they usually have multiple sexual partners. They may not be practicing safe sex. So those are the patients that are really should be taking PrEP. It can help patients who are sharing needles, and they can take PrEP as well. How does PrEP prevent HIV? So basically, if there is an exposure to HIV occurs in your body, the PrEP medication would uh, stop the virus from taking residence in your body and spreading it in your body. PrEP is very effective. It can significantly reduce the risk of HIV, probably by over 90% from the studies that we have. How quickly does PrEP work? Two things that I want to talk about is PrEP takes longer to become effective in vaginal tissues than rectal tissues. So for patients who are having receptive anal sex, maximum protection can happen within 7 days of taking the medication. For patients who are having receptive vaginal sex, maximum protection usually takes up to 21 days. It's unfortunately not 100% effective, so you can still get HIV despite taking PrEP. So if the patient is compliant with the medication, there's really less likely for you to get HIV than somebody who is not taking it with compliance.